everyone, my name is Jennifer Edwards and I'm here today to present my evidence-based education and innovation project. My advanced nursing practice focus is community health and the education project focus is experience health, the health and wellness program training for staff. I ended up working with the staff development team for Duke Well. Duke Well already provides care management services for payers such as Medicaid and Medicare. However, they have recently contracted to start providing care management services for Experience Health patients. Just to give a little background and information on that, Experience Health is a new Medicare Advantage plan, and it's very innovative. It's where a health system and a health plan have come together to provide care management services. Under Experience Health, care managers will still provide complex care management services for some of the patients, which includes things like disease management, education, linking with resources, working with the patients to provide follow-up, and really focusing on patient-centered care plans, goals, and interventions, medication reconciliation, and things like that, with the overall goal of reducing cost, but to also ensure quality of care. With Experience Health, it's a little different. They also, with this, have a health and wellness program, which is more, is definitely different than the complex care management services. It's more like the worried well. Under Experience Health with Health and Wellness, there is 4 different programs, which is physical activity, smoking cessation, nutrition, and stress management. So in doing my needs assessment with the staff development team, their goal was to provide staff, which can include current staff or staff that just came on board to provide health and wellness services under Experience Health, that they were going to need training and education. This would also include things like their assessments, because in their Epic Maestro system, they created a whole new assessment tool for the health and wellness programs, the patient-centered care plans, goals, and interventions. Also, health-wise education materials that's located in their Maestro documentation system clinical reference area. So they would need to know the appropriate patient education materials to utilize for the health and wellness patients from that area. So it was going to involve a lot of like documentation training, and they saw the need of really honing in on these 4 different programs since it was brand new and what that entailed. So with the 4 different programs, I worked with them to provide education materials, which consisted of program guides for each of the 4 programs that not only are going to be utilized for the education, it also serves as a reference tool for staff to refer back to. The description of the plan education would consist of the developing the program guides, which has already occurred for the 4 health and wellness programs: smoking cessation, nutrition, physical activity, and stress management. And then determining those appropriate health education materials and the links for them in the actual Maestro system that will also be provided within the program guides for not only the education learning, but also for a reference tool. The participants of this will be the care management staff, and they will all participate in this educational training, and the education will take place in a classroom setting. I will be utilizing a PowerPoint presentation that will actually have different information, including on the bigger screen with the program guides that they will use, because it gives like a program description. It also gives like the Epic Maestro flow sheets, assessments that will be in there, the problem, goals, and interventions, and the education materials for each program. Once we have gone through this and we've kind of discussed and what this looks like in the Maestro system, the staff will be given a case study where they can practice the documentation in Epic Maestro to actually have hands-on learning, while I'm there to actually provide any additional instruction or be there to answer questions as they're actually going through and having the opportunity to go through all these assessment flow sheets, utilizing that case study, coming up with their patient-centered care plans, goals, and interventions, and then locating the health-wise materials that they want to use for this particular case study. The theoretical basis and evidence to support this plan. The plan education innovation aligns with Bandura's social cognitive theory, as this theory places emphasis on a great deal of learning happens in a social environment, and a great deal of learning also comes from observing. Also, this theory also assumes that what students learn depends on motivation, interest, and incentives to perform, perceived need, physical state, social preference, pressures, and type of competing activities. I feel like this theory is influential to this module teaching, as it would take place in a classroom setting as a social environment, and the staff are required or utilize a patient scenario to practice the new documentation, which illustrates the incentive to perform via social pressure and a motivation because it's a perceived need. These strategies that I'm using for this education innovation in my teaching also capture the 3 principles for the universal design for learning, which is the engagement, representation, and the action expression. My intended outcomes for my education innovation project: prior to implementation of the teaching, we will be sending out a pre-test that will be utilized, and then once they have had the actual education innovation, then they will also complete a post-test before we adjourn that day. In order to be successful in their learning, how we will rate this outcome is that the staff will need to have at least an 80% passing rate, which will be required for the post-test. If they do not make an 80% or higher on the post-test, they will be, what we'll do is work together with the staff development team to come up with a plan to do additional changes to the instruction, and then of course provide additional education. I will then take that opportunity to research evidence-based information on best practices when there's additional education needs, and of course reaching out using resources and evidence-based resources to determine how I can change my teaching approach if needed, if I feel like there was deficits there that need to be tweaked in order to serve for the best outcomes, because we want all the staff to be successful, and this is really a groundbreaking, innovative structure that we really want to make sure that we're setting them up for success. Once we have done this, the next step that I will do is I will perform and analyze chart audits to determine the accuracy of the documentation of the assessments, patient-centered care plans, problems, goals, and interventions, and the health-wise education usage. And then once I have performed the chart audits, what I will then do is I will review the results and determine any additional problem areas that may need continuous review and ongoing education for staff. Then what we'll do is I'll determine a plan with the education staff development group. We'll determine that plan for ongoing quality assurance. I believe what that'll look like, in a sense, is just helping to achieve a valid chart audit tool that they could possibly use, or from my understanding, they already have the chart audit tool. I may need to make some tweaks to it, but once I get to that portion, I will determine and work with them to determine how they will do ongoing quality assurance, looking at maybe like on a monthly basis when they have their check-ins with their direct supervisors, which is the team leads, to have them like really do thorough chart audits on at least 2 or more charts, to provide that with staff, especially since it's brand new. It's always best that when we're coming out with something brand new like this, to catch any problems on the foreground, so that way we can go in and do any education and determine if there's anything else that they can do for the staff going forward to help them achieve their correct documentation and learning goals. And to make sure that from a data aspect that they're able to capture what they need. Because certainly, as we know, anytime that you implement a new program and we're creating new flow sheets and new templates within a documentation system, there can also be IT issues. It may be that some of the flow sheet areas are not being able to capture by data. So it's not necessary that it's always could even be a staff issue. We need to determine that we've given them the right tools in the documentation system to also be able to perform effectively and document effectively. So that kind of wraps up my project. I'm very excited to get started, and the staff development team has been very gracious to work with me, and it's been a very good learning experience. I wish the best for you all, and I look forward to hearing more about y'all's projects. Thank you so much. Have a good day.